In the May Medicare update, two deadlines are silently approaching, but overlooking them could cause beneficiaries to lose medical reimbursement rights, miss new programs, and incur unexpected costs next year. Beyond that, a decision recently announced by the government has left millions disappointed, while many other important benefits are quietly changing with hardly anyone receiving adequate warning. In this video, you'll understand what's really happening with Medicare, from the controversial policy withdrawal to expanding benefits for 2026, and most importantly, what you should do today to avoid being left behind when the system starts changing. There are two milestones silently approaching, and not everyone notices until it's too late. One small decision this May could make a huge difference, either preserving your full benefits in the Medicare program or accepting the loss of what you thought would be covered. May 15, 2025 is the final deadline to complete enrollment or make changes to Medicare Advantage plans if you want new coverage to take effect from July 1st. For many people, this is the only opportunity during the year to adjust benefit packages to match their current health and financial situations. But there's another often forgotten date that's equally important. That's May 31st, 2025. The deadline for submitting payment requests for medical services used throughout 2024. Missing this deadline could mean that all out-of-pocket expenses won't be considered for reimbursement by Medicare. A seemingly small oversight could turn an entire year of medical care into a financial burden. In an increasingly complex system with many adjustments and procedures, deadlines like these aren't just information. They're the boundary between peace of mind and unexpected losses. Perhaps what makes many people feel more secure at this moment is the information confirmed by the Centers for Medicare and Medicaid Services. There will be no increases in Medicare Part A or Part B premiums in May 2025. The standard monthly premium for Part B remains at $179. And the Part A inpatient deductible stays at $132 per benefit period. In a context where prices in many sectors are rising daily, Medicare's temporary stability is clearly a significant psychological anchor. When insurance figures temporarily hold steady and action deadlines approach, the feeling of security might lead some to think everything will remain the same. But the Medicare system isn't standing still. Hidden behind the cost stability is a series of policy adjustments that, if not noticed in time, beneficiaries could completely miss the most practical benefits, especially for those struggling with access to traditional health care or needing mental health support. Right in May 2025, Medicare is officially expanding benefits in the area of mental health care. Not limited to psychiatrists or general practitioners as before, the program now recognizes and pays for a new group of professionals, including licensed mental health counselors and marriage and family therapists. This is especially important for those quietly battling anxiety, depression, or chronic stress, but who never had the opportunity to access the right person with the right expertise. Being covered by Medicare helps remove the financial barrier, one of the reasons many people have previously chosen silence over seeking therapy. In parallel, another group is also receiving attention: those living far from medical centers or facing mobility difficulties, such as elderly people who no longer drive patients recovering from surgery or the disabled. Medicare continues to extend benefits for telehealth services, allowing patients to be diagnosed, monitored, and prescribed medications through online platforms with full coverage as if visiting in person. This policy, according to the latest confirmation, will extend until September 30th, 2025. In a context where not everyone can access clinics and not every area has nearby medical facilities, the right to remote care is no longer a luxury, but a necessity to maintain stable health without sacrificing comfort or risking delayed treatment. one of the most anticipated proposals in health policy for seniors, has been officially rejected. On April 4, 2025, the Trump administration announced that Medicare and Medicaid would not cover anti-obesity medications, including GLP-1 drugs like Wegovy or Ozempic, even though these are drugs being praised for their high effectiveness in weight control and prevention of dangerous complications. The controversy isn't about medical efficacy, but about the numbers behind it. According to estimates from the Congressional Budget Office, CBO, expanding coverage for these drugs could cost Medicare an additional $35 billion just in the next 8 years from 2026 to 2034. In a context where the Social Security system is under increasing spending pressure, the proposal put forward by the Biden administration, aimed at expanding drug access to all obese people, was rejected with a rather vague reason not appropriate at this time. Currently, Medicare still covers GLP-1, but only when prescribed to treat diabetes, sleep apnea, or prevent cardiovascular complications. For weight loss purposes, even when for health reasons, patients will have to cover the entire cost themselves. And this is precisely the turning point that makes many elderly people who must choose between the risk of complications and affordability feel left behind in the race with modern medicine. While other benefits are being quietly expanded, this decision serves as a reminder that not all progress reaches those who need it most. But are there changes being prepared for next year? Adjustments soon to take effect in 2026 will reveal the answer in the next section. After withdrawn policies such as Medicare's refusal to cover GLP-1 weight loss drugs, many people feel disappointed and worried about what benefits they might lose next. But in reality, not everything is moving in a negative direction. Important changes have been confirmed early for 2026. And understanding them now allows beneficiaries to actively prepare to benefit more and avoid being caught off guard as they have been before. One of the most notable changes is in the Medicare Part D program, which manages all prescription drug costs. Beginning in 2026, the out-of-pocket cost cap that participants must pay annually will increase slightly from $2,000 to $2,100. The deductible will also be adjusted from $590 to $615 per year. These aren't major changes, but are enough to create pressure if not calculated in advance. However, alongside these are positive policies that provide clear support. Insulin prices, which have been capped at $35 per month since 2025, will continue to be adjusted downward even further, starting in 2026. Welcome news for millions of seniors who depend on this essential medication daily. According to CMS, this change is part of efforts to reduce the burden of chronic medical conditions, which are currently Medicare's top spending cause. Most notably is the vaccine policy. Starting in 2026, all vaccines recommended by the CDC for adults, including tetanus, pertussis, measles, hepatitis, and many others, will be fully covered by Medicare Part D. No more co-payments, no deductibles, and most importantly, beneficiaries won't be restricted by where they get vaccinated. Whether at a pharmacy, hospital, or out-of-network provider, coverage remains at 100%. This helps avoid situations where many elderly people delay vaccinations due to concerns about miscellaneous costs, a common reason leading to unnecessary severe complications. Another significant improvement is allowing prescription drug costs to be split into 12 monthly payments instead of paying the full amount at the beginning of the year, as before. This option isn't mandatory, but for those with limited income, this installment plan can significantly reduce financial burden, especially early in the year when many costs appear simultaneously. All these adjustments have been confirmed by CMS in the official announcement of the 2026 plan published in April 2025. These changes are part of implementing the Inflation Reduction Act with the goal of making access to medications and medical care more reasonable and accessible for Medicare beneficiaries. Time remains, but with early preparation, from reviewing prescriptions to planning vaccinations and calculating payment methods, beneficiaries can enter 2026 proactively. Because in a system changing step by step, those who understand first maintain their benefits. Not every change brings a burden, but not everyone catches the benefits opening up in time. In a system where every decision is tied to deadlines, being proactive doesn't just help preserve what you have, it's the only way to not miss what better is coming. At this point, the most important action isn't worrying. It's starting to check your personal Medicare file on My Medicare. From confirming your current insurance plan to submitting change requests if needed, everything must be completed before May 15th if you don't want to lose the opportunity to make changes until next year. Also, for those who used medical services in 2024 but haven't submitted reimbursement requests, the deadline is May 31. An easy-to-forget milestone that could prevent thousands of dollars from coming back to you. If you're using prescription medications, don't wait until the new year to figure things out. Starting now, ask your pharmacy or insurance provider about the monthly payment program for medications beginning in 2026. For those living on fixed retirement income, this option could be the difference between continuing treatment or having to stop midway. Medicare is changing and will continue to adjust. Those who understand earlier are always those who maintain control. For those who wait until notification letters arrive, sometimes only regret remains. What's happening with Medicare isn't simply numbers, deadlines, or terms on paper. These are decisions that can directly affect healthcare accessibility, finances, and daily peace of mind. As the system changes step by step, closely monitoring and preparing early is no longer an option. It's necessary to protect yourself and your loved ones. If this information helps you understand better, avoid mistakes, or better utilize your benefits, subscribe to our channel right now, because we'll continue to update, analyze, and explain what's changing. Not with dry technical language, but with a practical, understandable perspective that's relevant to everyday life. See you in the next video.